Hey, folks, this is Andrew Bennett with insurancethatfits.com, where we fit the need and we fit the budget, and we help you get the insurance you need, health insurance and Medicare related policies. Now, what I'm here to talk to you about today is something that is coming to Medicare, traditional Medicare, in 2026. This is something new and something I'm not real happy about, quite honestly. Um, it really depends on how this is executed. Um, but I don't have high hopes for it. So let's get into it. Let me show you kind of what we're talking about. I'm going to share my screen, bring this up. And what this is the what they call the WISeR model, wasteful and inappropriate service reduction model. Now that sounds good. You always want to reduce waste. And they say here in the first sentence, waste in healthcare can not only harm patients, but it represents up to 25% of healthcare spending in the United States. Now, that sounds like, hey, we should take action on that, right? Okay, so if we follow the detail, the CMS website referenced this study in JAMA, the Journal of American Medical Association. I think that's what it stands for. Um, and its findings, these were reviewed from 71 estimates from 54 peer-reviewed publications, yielded the following estimated ranges of total cost of waste. Now, they talk about all sorts of things in here. Failure of care delivery. I'm really not sure exactly what that means. If care was attempted and the care didn't work, either the person died or maybe they had a surgery and it just didn't go right. Failure of care coordination. Care coordination is a big deal, but relative to some of these numbers, I mean, 27.2 billion, that's a lot. But when we get into some of these other numbers, it's not that big a deal. But care coordination is important. It's where you've got somebody who's got a complicated condition and multiple doctors need to be in communication with each other in order to really figure out what this patient needs. And that is not something the American healthcare system does well, getting doctors to talk to each other about a specific patient. Overtreatment or low value care between 75 billion to 101.2 billion. I'm thinking that's stuff like, your $8 aspirin when you're in the hospital. Um, when you get an x-ray for something you don't need an x-ray for. Pricing failure. Now, this one, I really have no idea what this means. Pricing failure, 230 to 240 billion dollars. I don't know what that is. Now, this is interesting. Typically, when you talk about fraud, waste, and abuse, they are different things. So you got your bucket of fraud, you got your bucket of waste, and you got your bucket of abuse. They have different definitions. Here, they're throwing fraud and abuse into the waste category. So that's interesting to me that they're doing that. And then administrative complexity, $265 billion. So the biggest categories here are this pricing failure, whatever that means, and administrative complexity, which we all know what that means, and failure of care delivery, whatever that means. Those are the three biggest things. Now, when we go back over here to WISeR, that's going to attack this 25%. That 25% is those things we just went over. And it's saying that Medicare spent up to 5.8 billion in 2022 on unnecessary or inappropriate services. Now, we want to save 5.8 billion if we can, but this 25% of healthcare spending, again, we go back over here, we're talking about 256 billion, 230 billion, 100 billion, 165 billion. And so they're targeting 5.8 billion of that. So right away, I'm really just kind of feeling that they're they're aiming the gun at the wrong target. So the wasteful and inappropriate service reduction model will enhance technologies like artificial intelligence and machine learning to streamline the review process for certain items and services that are vulnerable to fraud, waste, and abuse. This model is voluntary and will run for 6 performance years from 2026 to 2031. So model participants will be companies with expertise in managing the prior authorization process for payers using advanced technology like AI. So the second thing that really kind of worries me about this is these companies, these are for-profit companies, and it says here later in the document, they're getting paid for stuff they find, which on one hand makes sense, but now they have a profit incentive to find things and not approve the care. That is very, very problematic. I think the U.S. healthcare system has too much of that kind of thing already with Medicare Advantage plans. So um, this is something, again, if you want to read more about this, you can just contact me and I can send you this document. This is called an overview fact sheet. There's lots of these that CMS and different governmental agencies put out. But this is something that's coming. When it gets here, ask your doctors about it, see what they think. But I'm not really excited about this attempt. I just think there's a lot of problems with how this could be executed to stop care as opposed to root out uh, waste. There's lots of other categories with lots bigger dollars attached to it. You just take that administrative complexity at 265 billion, 265 billion versus 5.8 billion. And we're aiming at the 5.8 billion. Now, this on one hand, this doesn't mean that they're not trying to reduce administrative waste. But I think this is something that's got a lot of effort behind it, and I think they're just aiming at the wrong things because you eliminate half of 5.8 billion, and you really haven't touched the overall amount of waste in healthcare. So, folks, that's it for today. If you have questions, comments, cries of outrage, let me know. And Andrew Bennett with insuranceatfits.com. If you've got questions about your health insurance or your Medicare needs, give me a shout, shoot me a text, and I will help you any way I can. Thank you much, folks. Bye-bye.